Hello there. Are you preparing for a surgery exam soon? If that's the case, then today is your lucky day. In this video, we're going to go over 50 surgery MCQs. Each question has 4 options and only one of those is correct. You have about 7 seconds to choose the correct answer, and after that, the correct answer will be given along with an explanation showing you why that is the correct answer. You also have a chance to pause the video so that you fully understand the question and also the explanation that will be given. Let's get started. A 45-year-old man is evaluated shortly after undergoing radiation therapy and chemotherapy for primary laryngeal cancer. He also gives a history of long-term steroid use for rheumatoid arthritis. The patient also complains of a chronic non-healing wound on his neck just over his right clavicular head. Which statement regarding the treatment of this wound is true? A 27-year-old with a history of type 2 neurofibromatosis is scheduled to undergo resection of an acoustic neuroma. The NF2 gene is located on the long arm of chromosome 22. Which of the following statements regarding chromosomes is not true? Which of the following is an antifibrinolytic agent used in regular clinical practice? Which of the following statements about resuscitation for hemorrhagic shock is true? Transfusion of a unit of packed red blood cells into a hemodynamically stable patient with hemoglobin of 7.5 grams per deciliter does which of the following? Which of the following is not a proven etiology of disseminated intravascular coagulation? With regard to normal hemostasis, which of the following is true? Which of the following clinical scenarios is associated with hypercalcemia? Which of the following electrocardiographic ECG findings is associated with hyperkalemia? Which of the following statements regarding total body water is true? Which of the following has no effect on the development of hypernatremia? A 28-year-old male presents with perforated appendicitis. He is in severe discomfort and shows signs of activating his sympathoadrenal axis. All of the following activate the sympathoadrenal and hypothalamic pituitary axes during stress or injury, except a patient with pheochromocytoma shows signs of amino acid deficiency with coarse hair, dry skin and nails, and constipation. Which of the following amino acids is critical to the synthesis of catecholamines? On the 8th day after an exploratory laparotomy and bowel resection complicated by intra-abdominal hypertension, a 64-year-old female who remains intubated in the intensive care unit develops a fever of 39 degrees Celsius. An infectious workup reveals a new right lower lobe consolidation. When initiating antibiotic therapy for presumed ventilator-associated pneumonia, which of the following does not treat Pseudomonas aeruginosa? Which of the following is true regarding post-operative fever? A 24-year-old male presents to the emergency department after sustaining a puncture wound to his left foot 60 minutes prior to presentation. On examination, he has a small metal nail protruding from the plantar aspect of his left foot with moderate surrounding erythema and a small amount of bleeding, but no significant purulence. He is unsure of his tetanus vaccination status. How should the issue of potential tetanus infection be addressed in this patient? An 18-year-old man has a 12-hour history of vague periumbilical abdominal pain, anorexia, and non-bilious vomiting. The pain is localized to the right lower quadrant. On examination, he is found to have tenderness over McBurney's point. Which of the following best explains the localization of pain in the right lower quadrant of the abdomen? A 63-year-old man presents to the emergency room with epigastric pain of several days' duration. He has not eaten in 3 days. He has felt dizzy since the morning of admission. 2 weeks ago, his rheumatologist prescribed 800 milligrams of ibuprofen every 6 hours for joint pain. He is alert, oriented, and well appearing in the triage bay. Which of the following findings does not suggest shock in this patient with abdominal pain? Which of the following statements about bacterial contamination of the peritoneal cavity is false? A 33-year-old woman experiences an acute onset of epigastric and right upper quadrant pain several hours after a large dinner. She has had similar episodes in the past that resolved after a few hours. This episode persists and she has fever and non-bilious vomiting. What is the most likely source of the abdominal pain? An 85-year-old woman is admitted to the ICU with septic shock. She was previously healthy and did not take medications. She receives crystalloid resuscitation and broad-spectrum antibiotic therapy. Her blood cultures grow gram-negative rods. Her lipase is mildly elevated. An ultrasound of the abdomen reveals a common bile duct of 9 millimeters. There is no wall thickening or pericholecystic fluid. Endoscopic retrograde cholangiopancreatography reveals pus on entry into the common bile duct. A sphincterectomy is performed and the common bile duct is cleared of sludge and small stones. Following ERCP, her pancreatitis resolves and within 48 hours she becomes pain-free. What is the appropriate next step in this patient's management? A 23-year-old man suffers a pelvic fracture during a motor vehicle crash. He is admitted to the hospital for pain control and further evaluation. He complains of inability to void several hours later and is noted to have a distended abdomen. CT scan of the abdomen and pelvis reveals a distended bladder with contrast extravasation from the urethra. There is no free fluid in the abdomen. Which of the following constitutes appropriate initial treatment? Which of the following is an indication to give calcium gluconate in a patient with hyperkalemia? You are asked to see a 24-year-old male with no medical problems who sustained a gunshot wound to the right thigh 1 hour prior to arrival. He is a febrile with a heart rate of 136 beats per minute and a BP of 90/60 millimeters of mercury. He is initially alert and asking for water but becomes confused during your brief interview. Which class of hemorrhagic shock is this patient in? You are attempting to place a central venous catheter in the right internal jugular vein of a hemodialysis patient who is in the ICU after below knee amputation for a severe diabetic foot infection. Which of the following is true regarding the central line placement? A 20-year-old man involved in a motor vehicle accident is found to have a thoracic spine fracture, T6, and paraplegia. The patient is hypotensive with a systolic BP of 70 millimeters of mercury, is bradycardic with a pulse of 48, and is breathing comfortably. Which of the following would be the most appropriate initial treatment? The primary survey is best described by which sequence of steps? A 73-year-old female presents after being ejected during a high-speed motor vehicle crash. Her heart rate is 155 beats per minute. Her blood pressure is 60/35 millimeters of mercury. Emergency medical technicians were not able to obtain intravenous access. What is the best access for this patient so that fluid resuscitation can be initiated? An 18-year-old female presents after a motor vehicle crash and is in hemorrhagic shock. A massive transfusion protocol is triggered. What's the optimal ratio in damage control resuscitation? A 39-year-old male falls from a 4-meter ladder and lands on his left side. He fractures left ribs 2 to 9 with a flail segment, resulting in pneumothorax. After the chest tube is placed, what is the next best step in management? Which of the following regarding burn wound depth is true? Which of the following statements regarding the order of description of the zones of injury is correct? A 23-year-old patient has been in the burn intensive care unit, intubated and sedated for 2 weeks after an 80% total body surface area burn. He suddenly develops hypotension, tachycardia, and melena. What type of surgical problem is this patient most likely to have? The most common histologic type of melanoma is what condition is associated with the development of soft tissue sarcoma? Choose the correct statement regarding basal cell carcinoma. Match the hernia with the description. Which of the following statements is false regarding the iliopubic tract? Which of the following statements is true regarding direct inguinal hernias? A 73-year-old man is seen in the emergency department with a 2-hour history of an incarcerated femoral hernia. He takes warfarin for a past history of atrial fibrillation and has an international normalized ratio INR of 3 to 1. Which of the following is the correct treatment? A 56-year-old woman is found on examination to have a 3 cm breast mass with palpable axillary lymph nodes. A modified radical mastectomy is performed and the pathologic evaluation reveals a 3.2 cm infiltrating ductal carcinoma with 5 of 15 axillary nodes positive for metastasis. A review of systems is otherwise negative and findings on laboratory studies and basic imaging are normal. What is her tumor nodes metastasis TNM stage? Which of the following is not true regarding magnetic resonance imaging for evaluation of breast abnormalities? With regard to breast carcinoma in men, which statement is correct? Which of the following is not a characteristic of medullary breast cancer? With regard to Phyllodes tumor of the breast, which statement is incorrect? Which is not true regarding chronic granulomatous mastitis? When performing a thyroidectomy, which of the following anatomic considerations is incorrect? With regard to thyroid hormone synthesis and uptake, which of the following is correct? Which of the following antibodies is diagnostic of patients with Graves' disease? All of the following are considered an increased risk factor for cancer in a patient with a thyroid mass, except calcitonin is produced by the parafollicular cells of the thyroid gland. Measurement of calcitonin is most useful in what disease process?